President-elect Donald Trump is promising to repeal and replace Obamacare. About 20 million Americans have signed up for coverage under the Affordable Care Act.
Yeah, but it's been mired in controversy and complaints that it's too expensive and offers too few options in terms of coverage. So what's next for Obamacare? The Fox Medical team's Beth Galvin is here with answers.
And good morning, Sine and Tom. And I wish I could say I knew, but I think it's really hard.
It's like 5 o'clock in the afternoon. You just say good morning.
Did I say good morning? Well,
your
sorry.
clocks are all off.
Sorry about that, but I think it's really hard to say exactly what's going to happen until Mr. Trump actually takes office, because it's complicated. Some parts of Obamacare are really popular, others not so much. So we talked to a health policy expert at Emory about what's likely to stay when it comes to Obamacare and what could go. President-elect Donald Trump has been promising for months on the campaign trail that Obamacare will soon be history. But Dr. David Holden, associate professor of health policy at Emory's Rollins School of Public Health, says don't expect any major changes to the Affordable Care Act, at least anytime soon.
So I think the Republicans don't want to do anything that's going to further destabilize insurance markets. And they also don't want to have stories running on the news every night about cancer patients getting thrown off insurance.
For that reason, Holden believes the Trump administration will keep two popular pieces of Obamacare: the provision that bans insurance companies from denying coverage to people because of a pre-existing condition, and the clause that allows young people to stay on their parents' health plan until they turn 26.
That's not very costly. It's not very controversial. I don't think Republicans are going to repeal that.
One thing that will almost certainly go, and maybe quickly, the requirement that you purchase insurance coverage or face a tax penalty.
The individual mandate is very unpopular with Republicans. I think they will be under a lot of pressure to strip that away.
Dr. Holden says it's unlikely the Affordable Care Act will be repealed outright, because that would destabilize the entire insurance market and could leave at least 20 million Americans and their insurance providers with few options.
And if insurers threaten to walk away from the individual market, that will really tie Republicans' hands. So I expect that they're going to go pretty slowly, and a lot of the elements of the Affordable Care Act are going to be kept in some form. And
Tom told you 20 million Americans have signed up for Obamacare, but 27 million have chosen to forego the coverage and pay the tax penalty. And I think many Americans are now wondering if they really need to sign up for coverage for 2017, because this is open enrollment, because they don't really know if Obamacare is still going to be around. But Dr. Holden says go ahead and bite that bullet, because he's predicting that any changes to this law will take a while, maybe years.